Good morning. This is All India Radio Kohima. The morning news read by Ketholeno. The High-Powered Committee, HPC, on COVID-19 has decided to extend the ongoing lockdown measures in the state till 31st of this month. This was decided during the HPC meeting held under the chairmanship of the Chief Minister Nipiu Rio and co-chaired by Deputy Chief Minister Waipaton in Kohima yesterday. On the 29th of last month, the State Cabinet had extended the lockdown measures, which had started on 22nd of March this year, till 15th of this month. Principal Secretary Home Abhijit Sinha in the daily COVID-19 briefing said that the HPC reviewed existing lockdown measures in the state and also the modified plan submitted by the Health Department for declaring containment zones and its protocols. He said HPC also deliberated the functioning of the quarantine centers and reviewed the existing provisions of the SOP for returnees. Sinha said the HPC further reviewed the availability of essential medicines and medical equipments and other essential accessories with the Health Department, while also directing the department to expedite the process for recruitment of additional doctors and nurses so that their services could be used for strengthening the healthcare system across the state without delay. The medical department had appealed to the returnees in quarantine centers to adhere to the laid-down quarantine guidelines so that the stay at the center is safe for everyone. Chief Medical Officer Dimapur Dr. Tiasana Ponganar informed that there were instances where spread of COVID-19 infection happened among returnees for not following the quarantine rules, leading to some returnees being discharged after 32 days instead of 14 days. He advised the returnees to maintain strict social distancing, wearing face masks at all times, frequent hand washing, avoid spitting and loitering while staying at the quarantine centers so that one is released on time. He said the facilities may not be like at home, but the short stay at the institutional quarantine center will be a lifetime experience. He said in case of any health issues, one may contact quick response medical teams. The People's Democratic Alliance PDA of Nagaland, a coalition of the ruling Nationalist Democratic Progressive Party NDPP and BJP in the state has reiterated its call for early resolution of the decades-old Indo-Naga political issue through a negotiated political solution that is honorable and acceptable to the people. The reiteration was made as part of its resolution adopted during the PDA meeting held yesterday in Kohima. It was issued by PDA convener and NDPP President Chingwang Konyak and co-convener and State BJP President Temjen Imna Along. The PDA, taking into account the concern of the state governor on the overall scenario of the state on important matters related to the welfare of the people, the coalition partners appreciated and endorsed the statement of the state government issued on 2nd of this month in response to the letter addressed to the Chief Minister on 16th of last by the governor. They asserted that PDA will continue to carry out its constitutional duties with utmost commitment and dedication in the greater interest of the people. Meanwhile, PDA appreciated the state government and all machineries that have been successfully working round the clock for the past 4 months in combating the global COVID-19 pandemic. PDA also lauded everyone for making extraordinary sacrifices and jointly working with the state government to overcome the hurdles and challenges posed by the pandemic. And Nagaland is joining in observing World Population Day today under the theme Preparation for Family Planning Even in Times of Disaster, Full Responsibility of Competent Nation and Family. Mission Director, National Health Mission Nagaland, Dr. Kevichasa Medikra, in his message on the occasion, asked people to plan one's family and adopt small family norms in order to give their child a better future. Informing that World Population Stabilization Fortnight is observed from today till 24th of this month, Dr. Medikra said free family planning services, both temporary and permanent, will be provided during the fortnight in all the government hospitals across the state. With that, we end the morning news. Have a nice day.